Cleft lip, also known as hare lip or cleft lip and palate, is a congenital condition where there is a gap or split in the upper lip. This condition occurs during early fetal development when the tissues that form the lip do not completely fuse together. As a result, a visible gap forms in the upper lip, sometimes extending to the base of the nose. Cleft lip can vary in severity, ranging from a small notch in the lip to a more extensive opening that may involve the nostril and affect the appearance of the nose. In some cases, the condition may occur on one side of the lip, unilateral cleft lip, or both sides, bilateral cleft lip. Cleft lip can occur as an isolated condition, but it is often associated with cleft palate, where the roof of the mouth also has a gap. This combination of cleft lip and cleft palate can lead to difficulties with feeding, speech development, and increased susceptibility to ear infections. The exact cause of cleft lip is not always known, but it is believed to result from a combination of genetic and environmental factors. Certain genetic mutations and maternal factors, such as smoking, alcohol consumption, or certain medications during pregnancy, may increase the risk of cleft lip development. Treatment for cleft lip typically involves surgical repair, which is often performed when the child is a few months old. Skilled surgeons work to close the gap and create a more natural appearance for the upper lip. Additional surgeries may be needed as the child grows to improve speech and address any associated issues with the palate. Alongside medical treatment, individuals born with cleft lip may also benefit from speech therapy, dental care, and psychological support to address any social or emotional challenges they may face. Fortunately, advances in medical care and surgery have significantly improved outcomes for individuals with cleft lip, allowing them to lead healthy, fulfilling lives with appropriate care and support.